Welcome to Dr. Ruby's Tuesday, just dropping a gem. Today I want to talk to you about what it means to flatten the curve. One of my friends wanted me to kind of talk about this on my little episode of Dr. Ruby's Tuesday, just to make sure that everyone had a good understanding while we're going through this pandemic with the COVID-19 virus. What flatten the curve means is during a pandemic, you have interventions that you can instill or ask the public to do that can make the curve of people that are infected, instead of it being way up here, it can be more so like this. So those interventions are things like the social distancing, the avoiding crowds of 10 or more, the non-essential travel, not doing that, washing your hands, everything that they've put in place to keep us away from each other is an intervention to make the curve flatter. Make the curve here instead of here. And why that's important is because the higher the curve, the bigger effect that it will have on hospitals and healthcare workers, and the less likely that they will have the people, the manpower, the equipment that they need to take care of the large number of people who get the disease if there's no interventions, which is much different. If you stay at home and you practice these interventions, then people will continue to get the virus, but it's more likely that hospitals will be more equipped to care for those. Already you see that there's shortages that people are talking about at different hospitals, and masks and the things that healthcare workers need in order to deal with this pandemic. So it's just a plea to everyone to please listen to Dr. Fauci, the CDC, the World Health Organization, Dr. Adams, the Surgeon General, because they're sending clear warnings. COVID-19 is real, and everyone needs to know that you can get sick from it no matter what your age is. Initially, they were talking about the most vulnerable, which the most vulnerable is still the elderly, but New York, they shared their stats, and the people who were hospitalized were between the ages of 20 and 44. About 20% of those people who were ill were between that age group. So young people, you're not invincible. You can get it too. If you don't get really bad sick, you can still carry that to your parent or your grandparent, and they might not survive from the virus. So please, people, please practice social distancing. Please stop the gatherings. And I know the gatherings are still happening. I went outside today and I saw a neighbor who was having a party. They had a lot of people over there, kids, adults, grandmas, looked like, just not listening. This is real, people. And right now, the Surgeon General just said today that things would probably get worse. Well, you can help that. How you can help that is by social distancing. These cities who have enacted this stay-at-home order, I love it. It's good, because it seems to me that people are still not taking this as serious as they need to. So please, for the healthcare workers, the nurses, the doctors, the respiratory therapists, social work, environmental service, nutrition and food service, facilities, everyone that works in hospitals, healthcare workers, period, they need you to stay at home so that they will have the resources to care for these patients. The other people, the people who are also necessary, are those people working in grocery stores or those factories that are providing essential things for us. We need to make sure that we do the things that we need to do to keep this spread of the COVID-19 down. We just need everybody to please take this seriously, because it is very serious. Just please, please practice social distancing and listen to what those people in authority are asking us to do. Thank you for listening to me, and I will talk to you next Tuesday. Bye-bye.